Hi, I'm Prateek, and in this video we're going to be looking at hand, foot and mouth disease, an incredibly common viral illness.
Remember, if you want thorough revision notes, exam cheat sheets, CPD, along with a huge bank of exam-style questions and guidelines, head over to ExamineDental.com. We also have expert one-to-one mentoring sessions in order to help you ace those interviews and exams.
Hand, foot and mouth disease is an incredibly common viral infection predominantly found amongst children. It is highly contagious, but it is self-limiting. It shares very similar traits to herpes angina. Hand, foot and mouth disease is primarily caused by the virus Coxsackie-A, though there are a couple of other viruses that are responsible for it. It's spread, again, in a similar fashion to herpes angina, through methods such as respiratory droplets, touching contaminated surfaces, or fecal-oral spread. It is a condition that predominantly affects children, so we tend to see outbreaks in nurseries and schools. Usually, it's those under the age of 5. The incubation period for hand, foot and mouth is approximately 3 to 6 days, and it has a very classic oral presentation. Patients will usually develop small vesicles along the lateral borders of the tongue, the buccal mucosa, and the palate. These vesicles then usually rupture to leave behind shallow, painful ulcers with a red halo. Because of the discomfort from these ulcers and vesicles, children will often find themselves drooling rather than swallowing their own saliva. The patient will also develop a maculopapular rash on the palms of their hands and the soles of their feet. As with other viral illnesses, they develop the classic systemic symptoms, including a mild to moderate fever, malaise, and a loss of appetite. Because it's a self-limiting condition, the symptoms usually last 7 to 10 days, and then the virus burns itself out. Hand, foot and mouth disease is diagnosed through the history and the clinical presentation of a child. However, there are some other common differentials that need to be considered, including herpes angina, herpetic stomatitis, and even chickenpox. As it is a self-limiting condition, management is symptomatic based. This includes a soft bland diet, antipyretics, topical anesthetics or analgesics, and keeping a child hydrated. Because it's such a contagious condition, strict hygiene and decontamination processes need to be followed to prevent it spreading from person to person. So in this video, we've looked at hand, foot and mouth disease. We've looked at the etiology and the common clinical presentation, as well as how we will manage these patients in the self-limiting condition. Over on the ExamineDental website, we have a revision note about hand, foot and mouth disease that goes into a little bit more detail, along with an exam-style cheat sheet. So make sure to head over and check this out. I hope you found this video useful. If you did, please make sure to like, comment and subscribe. Until the next video, take care.